Hi everybody, I am going to talk about the sensory impairment. Sensory impairment refers to difficulty either in seeing and or hearing, which are the receptors that perceive and interpret the information about the world around. There are different levels of difficulty. For instance, some people may not be able to hear at all, while some others will be able to hear partially and might use hearing aids. The same way, a person could be totally blind or able to see partially. At the end of this talk, you will gain adequate knowledge about the concept of sensory impairment, know the different types and levels of sensory impairment, develop the ability to identify and access the persons with the sensory impairment, and understand the specific interventions for the persons with sensory impairments. Let me tell you about the meaning of the sensory impairment. Sensory impairment is when one of the senses such as sight, hearing, smell, touch, taste, and spatial awareness is no longer normal. For example, someone may have a sight impairment and wear glasses, or may have a hearing impairment and wear a hearing aid. A person does not have to have full loss of a sense to be sensory impaired. Let me describe the hearing impairment as one of the sensory impairments. Hearing is a process of detection, discrimination, recognition, and comprehension of sounds. Hearing impairment may be defined as any deviation or change for the worse in either auditory structure or auditory function. This may involve any defect in the hearing process due to hereditary or environmental factors. Owing to this impairment, the person cannot use his or her hearing for ordinary purpose. Hearing disability is defined as the auditory problem experienced and complained by the individual. When the impairment reduces the person's functional potential and restricts his or her level of performance, it becomes a hearing disability. The Persons with Disabilities Act 1995 recognizes hearing impairment as a disability, defining it as a loss of 60 decibels or more in the better ear in the conversational range of frequencies. Hearing handicap is a disadvantage for an individual resulting from the impairment or disability which limits or prevents the fulfillment of a normal role depending on age, sex, and cultural factors for the individual. The restriction imposed upon or acquired by the individual affects the efficiency of his or her day-to-day life. Let me describe the meaning of visual impairment. Vision is the most important sense required to observe and learn from what is happening in an environment. Visual impairment can be divided into two types, namely low vision and blindness. Low vision refers to reduced functional vision in the individual. Low vision may demand large print materials and magnifiers for reading. Recent technological advancement has facilitated better learning opportunities for low vision children. A person with low vision is one who has impairment in visual functioning even after treatment. Blindness refers to a condition where a person suffers from total absence of sight or extremely limited field of vision or visual acuity not exceeding 6/600 or 20/200 in the better eye, even with the corrective lenses or limitations of the field of vision subtending an angle of 20 degrees or worse. Let me explain about the deaf blindness. Deaf blindness is a dual sensory loss involving visual as well as auditory sense, and it creates such severe communication and other development and learning needs that they cannot be educated without special education and related services. Let me discuss about the different methods for identification and assessment of all types of sensory impairments. The identification can be done through common features or symptoms and through formal clinical methods. The child with a hearing impairment can be identified during childhood through these symptoms such as history of high risk factors, absence of normal response to various sounds, language development not seen even after 1 to 2 years of age, attention on the lips of the speaker, liquid discharge from ears, and constant itch in the child's ear. The hearing impairment at classroom level can be identified through lack of linguistic skills normal for one's age, difficulty in comprehension, specific problem in reading and speaking, slow mastering of language skills, and asking for repetition frequently. Assessment of hearing impairment can be done to know the degree and type of hearing loss. In order to make assessment of infants and children, there are a number of screening audiological tests available depending upon the age of children. Infants with congenital or neonatal hearing loss can be identified using objective physiological tests such as the auditory brainstem response evaluations or the otoacoustic emission before 3 months of age, and an intervention program starts soon thereafter. Both these tests are accurate, non-invasive, and do not require any observable response from the infant. For the purpose of screening, both the methods are extremely effective. In order to process sounds, electrical impulses are transmitted through nerves from our ears to the brainstem at the base of the brain. An auditory brainstem response is a physiological measure of the brainstem's response to sound. It tests the integrity of the hearing system from the ear to the brainstem. The automated auditory brainstem response is another objective means of evaluating hearing. It is mainly used in many newborn screening programs. The instrument is automated and in such a way that it provides a pass or fail report. No test interpretation by an audiologist is required. Play audiometry is a behavioral test aimed at measuring the auditory threshold in response to speech and frequency-specific stimuli presented through earphones or bone vibrator. Conventional pure tone audiometry is a behavioral test measuring auditory thresholds in response to speech and frequency-specific stimuli presented through earphones or bone vibrator. The child is instructed to raise his or her hand when stimulus is heard. It gives ear-specific results and depends on the level of understanding and cooperation of the child. Visual impairment. When prevention of disability is not possible, cure becomes the objective. When cure is not possible, rehabilitation becomes the goal. Identification and assessment help a great deal in facilitating rehabilitation of the blind and those with low vision. Blindness as a visual impairment may be identified with the help of some common features, such as that the child tilts his or her head to locate the light source, has pain and irritation in the eyes, bumps into objects in the environment, is unable to write from the blackboard and takes help from peers to copy from the blackboard, has poor performance in the class, is unable to read in poor lighting conditions, is unable to see during night, depends too much on oral information, rubs eyes excessively, has watery eyes, has eyelids which are often red, holds objects and the book too close to eyes, squints or blinks when looking at something, blinks more frequently, and gets regular headaches. Low vision as a visual impairment may be identified with the help of common features, such as that the child has confident movement in school environment, has a visual orientation to the new stimulus, is able to gaze at light, avoids response to shadows, is interested in visual games, tilts his or her head unusually, gets easily distracted by movement in the environment, makes troubled responses to suddenly approaching objects, experiences difficulty in identifying small detail in pictures or illustrations, complains of dizziness frequently after reading a passage or completion of assignments involving vision, and gets headache frequently or infection in the eye, or the child uses one eye more than the other. Let me outline some informal methods to identify visual impairment. Parents and teachers can identify the symptoms at home or in the classroom through direct observation, such as light perception of difference between good light and poor light in a class, tracking of light, detecting hand movement, distance of detecting hand movement, while counting, fingers raised one at a time, or fingers spread apart, or fingers close together. Visual background, color detection, visual closure, eye-hand coordination, eye-foot coordination, print size preference without magnifiers, print size preference with magnifiers, time taken to read a passage in mother tongue or English, ability to write, and writing speed. The assessment of visual problems requires teamwork of educational, medical, and other personnel such as social workers, volunteers, and health workers. Let me mention about some of the assessment tools. Snellen test and visual field tests are used to measure visual acuity and visual field. Muscles balance test is done to test muscle balance, and special instruments are used. The most common tests are Maddox rod test, allied muscle balance test, tests for distant vision, plus lens test, and near vision testing. With regard to the assessment of deaf blindness, all the methods applied for identification of hearing and visual disability may be used in combination for identification of deaf blindness in an individual. There are many causes which directly or indirectly contribute to the development of sensory disability. Some causes are dominating contributors and some other are supportive in the development. Let me now tell you about the levels of hearing loss. A child with mild hearing loss will have trouble hearing and understanding soft speech in a noisy background. A child with moderate hearing loss will have difficulty in hearing conversational speech. A child with a moderately severe hearing loss will have difficulty in hearing conversational speech even at close distance. A child with a severe hearing loss may only hear loud environmental sounds. A child with profound hearing loss may only hear very loud environmental sound. Let me outline the types of hearing loss. 1. Conductive hearing loss refers to hearing loss due to any problem in the outer ear and or middle ear. 2. Sensory neural hearing loss means hearing loss due to any problem in the inner ear and or auditory nerve. 3. Mixed hearing loss is understood as hearing loss due to any problem in the outer and or middle ear including inner ear. 4. Central hearing loss means the hearing loss due to defects in central auditory processing. The child can hear the sound but has problem in understanding and interpreting the speech and language. 5. Functional hearing loss is a hearing loss when there is no anatomical and physiological abnormality in the auditory system, but the child has problem in hearing due to malingering or psychological problems. Vision 2020 has identified many causes of avoidable blindness for immediate priorities on the basis of the burden of blindness they represent and the feasibility and affordability of interventions to prevent and treat them. 1. Cataract refers to a clouding of the crystalline lens of the eye and stands out as a first priority among the major causes of blindness. 2. Trachoma remains the most common preventable causes of blindness in the world. It is common in areas of the world that are socio-economically deprived of basic needs in housing, health, water and sanitation, including India. 3. Childhood blindness is caused mainly by vitamin A deficiency, measles, conjunctivitis in the newborn, congenital cataract and retinopathy of prematurity. Other causes of childhood blindness that are congenital or genetically determined do not generally lend themselves easily to preventive strategies at present. Childhood blindness is considered as a priority area because of the number of years of blindness that ensues. Its developmental implications are tremendous. Let me mention the 4 groupings of deaf blindness. 1. Congenitally deafblind refers to individuals who are born with vision and hearing loss. 2. Congenitally deaf and adventitiously blind refer to individuals who are born with deafness and later acquire blindness. 3. Congenitally blind and adventitiously deaf refer to individuals who are born with blindness and later acquire deafness. 4. Adventitiously deafblind or acquired deafblind refers to individuals who are born with hearing and vision senses but later lose both the senses in varying degrees and at different times. Let me tell you about the interventions. Intervention is a major and important aspect of rehabilitation process. It is a team approach in which the role of parents, family members, medical personnel, therapists, social workers and community people are equally important. The intervention in the case of hearing disability consists of language and speech therapy, behavior therapy, family counseling, and fitting of hearing aid and ear mold. The most important period of language and speech development is generally regarded as the first 3 years of life. lesser degrees of hearing loss may go undetected even longer. The result is that for many hearing impaired infants and young children, much of the crucial period for language and speech learning is lost. The abilities of the senses will not develop unless they are specifically trained. As sighted persons tend to rely mostly on the vision, the other senses are not used to the optimum level, whereas a visually impaired person is compelled to use other senses. Therefore, proper training in the use of the remaining senses becomes vital. The ability to use the senses enhances the orientation and mobility skills of the child so that the child can understand the environment better. Therefore, systematic development of the abilities to use the senses becomes an integral part of the training to the visually impaired child. There are visually disabled individuals who are extremely capable of moving independently without any physical assistance in a known environment. Such individuals have a complete control over things in the environment, and their judgments about the distance and direction of these objects and the relation to self may be remarkable. Visually disabled children are trained by teachers and mobility instructors to have safe, secure, and graceful mobility skills. Persons with these abilities are able to move unassisted in known environments. Though this is commendable, the visually disabled individual must be encouraged to use a mobility device as it provides independence even in an unknown environment. The skills also differ between visually disabled person from birth and the one who has acquired blindness later in life. Physicians can play a vital role in guiding the therapies like a physiotherapist, occupational therapist, or speech therapist. They can provide information about the condition of the child, the prognosis, risks for associated disabilities, and the effect of continuing drugs. This information can be helpful in taking some decisions related to therapies. Families of children with multiple disabilities need support in the area of clinical assessment from doctors. Complete and appropriate information in a simple manner about the child's exact condition is a need for all family members. This is a specialized area for medical professionals and more so in the area of multiple disabilities. The main cause for disabilities is related to genetic factors. A genetic test analysis and counseling at the appropriate time will reduce the occurrence of children with multiple disabilities and impede the spread of the disability further. Let me sum up. Sensory impairment refers to difficulty either in seeing or hearing. Hearing disability is defined as the auditory problem experienced and complained by the individual. Low vision means reduced functional vision in the individual. Deaf blindness is a dual sensory loss involving visual as well as auditory sense. There are different methods for identification and assessment of all types of sensory impairments. The identification can be done through common features or symptoms and through formal clinical methods. There are some informal methods to identify visual impairment. Parents and teachers can identify the symptoms at home or in the classroom through direct observation. The most common tools of assessment for visual problems are Maddox rod test, Allied muscle balance test, test for distant vision, plus lens test, and near vision testing. There are many causes which directly or indirectly contribute to the development of sensory disability. Some causes are dominating contributors and some other causes are supportive in the development. There are different levels as well as types of hearing loss. Cataract, trachoma and childhood blindness are the main causes of avoidable blindness. Special education is required for children with sensory impairments. The intervention in the case of hearing disability consists of language and speech therapy, behavior therapy, family counseling, and fitting of hearing aid and ear mold. Visually disabled children are trained by teachers and mobility instructors to have safe, secure, and graceful mobility skills. Persons with these abilities are able to move unassisted in known environment. Families of children with multiple disabilities need support in the area of clinical assessment from doctors. Complete and appropriate information in a simple manner about the child's exact condition is a need for all family members. Let me sign off now and hope to see you in another session. Thank you.